Let's bring in now California Congresswoman and former registered nurse, Karen Bass. Congresswoman, how are you doing, and how is your state seeming to make all the right choices?
Well, I'm very proud of the leadership, not just on the state, but also in the city, because I do think that we're doing everything that we possibly can here to follow the isolation, to make sure that people go in and get tested if they have symptoms. So I'm proud of what we're doing here, and I'm also proud that we're willing to share. I do think, though, that it would be so much easier if we had such better leadership from the administration where things were more centralized so states didn't have to fend for themselves.
Congresswoman, there's been a lot of attention paid to the president's feuds with different governors. How has Governor Newsom navigated the president in a way that has, if not aided California's fight against corona, certainly not hampered it?
Well, I think that he has shown true leadership. I mean, one of the challenges we always have with the administration is just the pettiness. And I think even though the governor has had conflicts with the president, he has risen to the occasion, risen above all of that, and is working on behalf of our state. Now, having said that, in Los Angeles, you know, I am concerned, as I am in a number of cities around the country, the disproportionate death rate for African Americans. So even though we're doing well here, as the governor said last night, we cannot take our eye off the ball. We have to address the disproportionality.
I was going to ask you about that. I spoke about 24 hours ago to Chicago Mayor Lightfoot about that. And she said it was shocking that the numbers are so outpacing the numbers for other groups, even other age groups. What sort of rapid response and surge of resources do you think we need, not just in California or not just in your district, but nationwide to address that?
Well, nationwide, I think there's several things that can be done. And another hat I wear is chairing the Congressional Black Caucus. We were on a call yesterday with African-American physicians from around the country, and there were a few very specific things. Number one, we need focused and concentrated testing. So where you see the numbers so disproportionate, like 70% in Chicago and New Orleans, there needs to be focused testing. And then also the medical facilities in those areas need to be able to turn the test around. So the idea that in New York it takes 7 or 10 days to get the results back is unacceptable. Well, I have talked to physicians from around the country who say that they actually have the money to pay for the machines to rapidly turn around the results, but the administration won't release those machines. And so we are definitely trying to push so that those areas can do that. The other thing we need is we need direct funding to communities so they can do a public health education campaign, because there's a lot of counter messages to the personal distancing and all that are coming into the African American community saying, don't be concerned about this. This is just, a hype. Or the other issue that is impacting the Black community is the whole notion that there is a cure. And so when the president pushes the malaria medicine, ironically, that medicine is also used in lupus patients, and African American women disproportionately have lupus. So now they're having trouble getting access to medications that they need for a medication that may or may not work with COVID.